Hypoesthesia is a common side effect of various medical conditions, which results in reduced sense of touch or sensation, or even in severe cases, partial or complete loss of sensitivity to sensory stimuli. Sometimes people also like to refer to this as numbness, but it is a lot more severe than, say, for example, your foot falling asleep for a couple minutes. A few examples of the most common illness and disease that can cause hypoesthesia as a side effect are including but not limited to decompression sickness, which occurs most commonly in scuba or deep sea divers. The cutaneous sensory disorder or the tuberculoma of the spinal cord could also lead to the loss of sensation. A patient experiencing symptoms of hypoesthesia is often asked or diagnosed through a series of questions to pinpoint the location and severity of the sensory disruption. If you're someone who have diabetes or arthritis or some other conditions, or you're someone who abuses drug or illegal substance a lot, or you're someone who do not have a well-balanced diet or are not getting enough vitamins or minerals, you have a high risk of developing hypoesthesia. The treatments for hypoesthesia depends on the underlying conditions causing the numbness. Some possible treatments include changing or lowering the dosage of the drug you're taking. You can either ask your healthcare provider or your doctor to prescribe another type of medication. If it's caused by a certain vitamin deficiency, you might be suggested to change to a different type of diet or eat additional supplements. If your hypoesthesia is caused by diabetes, maybe try take steps to better manage your blood pressure and take care of your feet by wearing comfortable and supportive shoes. Lastly, if it's caused by some sort of nerve injuries, the use of steroid could be effective with facial, optical, and spinal cord nerve injury. Most of the time, the everyday life of a patient with hypoesthesia would not be affected too much. However, since the patient with hypoesthesia has a more dense or numb sensation compared to normal people, they need to be more careful, especially when it comes to injury or bleeding, since their body has not been able to use pain as a normal stimulation to warn the person that a cut has occurred and a person's life could be threatened if the bleeding or the injury was not properly treated in time.